imaging, and CT is the imaging modality which gives the anatomical cross-sectional imaging. So what is PET? PET is a positron emission tomography. So what is positron emission? When an atom which comes to an unstable pattern, that neutron will release a positron and neutron. When the positron is released, it gets annihilated with the electron. It produces straight opposite 257 keV electron. So this is known as a gamma ray, which is being captured in the two opposite direction in the detector. So this is known as a PET imaging, positron emission tomography imaging. So next comes the CT. CT is basically which gives the anatomical information by the cross-sectional imaging. So it is basically multi-projection images will be combined to see as a single image to view the internal structures of the human anatomy. So that is the main aim of the basic principle of the CT. So these two modality is being combined and it is known as a fusion imaging modality, that is PET CT imaging. So what is PET CT? It's a functional PET images are fused with the anatomical CT cross-section images to provide more accurate diagnosis of human diseases. So what happens here? This PET image, it's a first one is a PET image. It will be combined with the anatomical images of CT and it will be fused and shown as a PET CT image. So both functional and anatomical structures can be viewed clearly in the imaging modality. So that is known as a fusion imaging modality, PET CT. So this is how the gantry of the PET CT will be looking. So in first we will have a PET detector and second we will have a CT detector system. So both the things will be combined as a single modality. So that's how it will be seen in the PET CT modality. Both the thing will be fused together and gantry will be fused. So this is how the PET CT gantry will be looking. So today's thing we are going to see about the main thing is the PET CT instrumentation, PET CT room design and PET CT application. So these are the main agenda for today's topic. Moving on to this PET CT instrumentation. What comes under the PET CT instrumentation means mainly PET instrumentation and CT instrumentation. Both the modality instrumentations. So what is being covered in the PET instrumentation is detector, PM tube, that is photo multiplier tube and pulse height analyzer. So these are the main thing which is going to do the work in the PET. And coming to the CT data acquisition systems are mainly combined with the detector and with the X-ray tube. So that is the main thing which gives the image data for CT. So these are the instrumentations we are going to see in the next few minutes. So this is how the gantry will be looking. The first thing is the CT component. CT component will have a X-ray tube and detector. So X-ray tube and detector will be seen there. And then next thing is the PET component. PET component has only the PET detectors. PET detectors will be consisting of a scintillating crystal and photomultiplier tube with the pulse rate analyzer. So this will be inside the PET detector system. Both will be seen as a single gantry system, that is PET CT gantry system. So basically the PET imaging which gives the functional imaging technique that produces three-dimensional images of functional process in a body. And also it's been getting the positron emitted radionuclide tracer imaging and which will be injected in the patient body and we will get as an image detail. So in this PET detector, so first of all I told the PET detector and then pulse analyzer, photomultiplier tube. So first thing to see is a PET detector. PET detector, which consists of a scintillating crystal. When a gamma ray falls on this scintillating crystal, it produces the light energy. So light photon will be emitted. So that light photon will be sent to the photomontiplier tube, and this light flashes produced are used for measuring the radiation parameters in the energy level intensity of radiation in the PET detector system. So what makes the PET detector, and how will you define the characteristics of the PET detector? These are the main things. That is, first one is a stopping power of energy. That 511 kV it should stop. That is the main thing. Stopping power is the main thing. And then scintillation decay time. So what do you mean by decay time? Means if you blow a bulb, it should stop. When you switch off it, it should stop immediately. When it not stopping, it glows slightly and stops. Means that is known as a decay time. When the crystal receives the light converts the light photons, it should be stopped immediately for receiving next light photon, converting next light photon. So that is known as a decay time. So every crystal should have a less decay time, then only the image quality will be very nice. So that is the main thing, decay time. And next is the light output. So if you give one gamma ray, that should be converted into many number of light photons. So according to the energy of what gamma ray you are going to give, that will be produced. The crystal type what they are going to use, it will produce the energy of light photons. So that mainly means in this light output. And then energy resolution. So it should give a good energy resolution, then only the image quality will be somewhat put in the fusion imaging modality. So crystal used in the PET CT is BSO, BGO, LSO, GSO and Na, that is sodium iodide crystal. So basically most of the vendors will be using this LSO and GSO. BSO is rarely used. I will tell about the characteristics of each and every crystal, what are the crystal properties has. So first characteristic of BGO has a highest stopping power, but it does not have a scintillation decay. It has a longer scintillation decay time and poor light output. First I told about the characteristics of each and every crystal. This crystal has a longer scintillation decay time, so it is not suitable for giving a good quality of images, and also poor light output. So some rare vendors will be using this BGO crystals. Next is a GSO. GSO is a crystal which is being used by some vendors. That is, it mainly produces the better energy resolution, but has a lower light output and lower stopping power. But decay time is somewhat moderate compared to the LSO. So its main default is lower light output and stopping power. But it's okay by giving a better energy resolution. So that is the characteristics of GSO. And next comes the LSO. Most of the vendor will be using LSO. Why? Because it has a high light output, high stopping power, and main thing is short scintillation decay time, 40 nanoseconds. So it has a very shorter decay time. So it is a good type of crystal can be used in the PET imaging. So you can see in this comparing all the crystals, density, effective atomic number, decay time, relative output, energy resolution. So in comparative thing, main thing to use LSO is it has a lower decay time. And next comes the photometric tube. After the light gets emitted from the detector, that is scintillating crystal, it will be sent to the photomultiplier tube. The name itself denotes photomultiplier. It multiplies the photoelectrons. Okay, so that happens in this photomultiplier. What is this device? Which converts the light photons which falls on this entry window will be converted to electrical pulse. So this photometric tube will be consisting of vacuum container with one end of cathode and another end as an anode. In between it has a diodes. So this diodes will help in multiplying the photoelectrons. So in this, when the light photon falls on the photomanipulator entry window, it will be accelerated towards the anode side. When it is accelerated towards the anode side, it will be focused to fall on the each and every diodes. So when it falls on each and every diode, it gets multiplied. The photoelectron is get multiplied. So then it will be converted into electrical signal. This is what happens in the photomultiplier tube. And next comes the PHA, third thing, that is pulse height analyzer. For example, what this pulse height analyzer does means it receives only the defined energy level of photons. So if you take this auditorium is full of 500 people for approximate, then it has only one entry door. That one entry door allows only 3 members. It has a discriminated level of energy. It will receive one particular level only. When it has a big door, it can leave or it can receive mainly 10 or 15 people. So according to the discriminated level what you fix in the PHA, it receives the energy levels. If you keep the more energy level to receive, the image scattering will be more, the image resolution will be very decreased. So always the PHA helps in sorting out the photons of different energies arising either from the individual photons or from the different radionuclides. So this is the main thing it will be doing, PHA will be doing. So basically the PHA is a discriminator with the lower level and upper level. So you can see EL lower level and EU upper level. Below that and above that will not be received. Only a particular 511 keV thing only will be received. So the energy gate level will be kept with the 511 keV receiving energy. So photons of selected energy are only accepted, others are rejected. So it will be kept at 350 to 650 keV level. Always the most of the thing PHA will be adjusted to this level. And next comes to the CT instrumentation. In CT instrumentation, basic principle of CT is that the internal structures of an object can be reconstructed from the multiple projection data. So it will convert the images from the multiple projection data captured by the each and every angle it is projected from the data will be captured, and it will be converted as a seen as the internal structures can be seen, and also we can see as a 3D volumetric data. So this is what happens in the CT. So it basically gives an anatomical information, cross-sectional information. So data acquisition system of CT will be consisting of X-ray tube, filters, collimator and detector. Main part is X-ray tube and detector. So this is what helps in capturing the image data of the CT. So in overall view of this image formation, what happens means, first thing, the patient will be done with the CT scan with the injection of contrast or everything. CT scan will be finished. Then the projection data are measured with the intensity profile and attenuation profile, and then it will be sent to the CT console. After that, the patient will be done with the PET imaging. The radioactive traces will be injected to the patient. Then this will be getting the PET gamma ray will be collected, and then it will be sent to the PET console. So both the things will be fused. This PET image and CT image will be fused together. That is where PET CT image will be formed. So this is what happens in the image formation of PET CT. So this is how it will be formed. This is the scout image, CT image is collected, and then PET image has been fused. It shows the PET CT image. So that's the coronal view of a PET CT image. And coming to the second thing, room layout. So basic roof layout, the total area of bed city construction will be from 150 to 160 square meter. So you should have a basic thing, bed city room area, scanner room area, console, physician room, technologist room, and it has a separate area where the patient preparation is done. The patient preparation area should be consisting of dose administration room, post-dose administration patient waiting room, and general toilet and active toilet which is present inside the dose administration room or adjacent to the post-dose administration room. So and then also hot lab which should also be present inside the dose administration room. So these are the main things should be seen in the bed city. So bed city facility should have this like of room design, and all the walls should be built above the concrete only. Concrete walls in the four the side and also in the top side. In the ceiling also should be a concrete one, depending upon the regulation given by the AARP. And it should have a waste storage room. All the disposable radioactive contamination should be stored in the waste storage room. That should be kept next to the hot lab. So this is the patient active toilet where after administering the radionuclide to the patient should be using this toilet only. Next is a hot lab. Hot lab where the radionuclide is produced. Radionuclide will be tagged with the tracer material and then injected to the patient. It will be produced in this hot lab only. It will be consisting of elements with lead bricks, dose calibrated to check the amount of dose should be given to the patient, and titanium syringe holder. So in that syringe holder only we should take the radionuclide to be injected to the patient. And next is dose administration room. Dose administration room should be present next to the patient dose giving room. Next is the room entry. Always the bed city facility should have a two room entry. One is the one is the console side entry. Other is the patient entry. Patient entry should have a double door lead line door. So any cord patient can be shipped inside the double lead line door. You should have a huge big door, and that is one is a console entry door. Next, coming the last thing, PET CT applications. What are the applications we'll be seeing? Before going to the application, what type of radionuclides are used in the PET CT means? Fluorinating is the basic radionuclide will be used, because why means it has 110 minutes of half-life period, higher half-life period. So fluorinating is basically used to be tagged with the tracer material, that is FDG. Fluorodeoxyglucose. It will be used as application of glucose metabolism imaging. So it will be tagged with the tracer material of FDG. So other are oxygen, nitrogen, carbon, and then rubidium. So coming to the application of FCT. So in oncology imaging, the tumor evaluation, determination of the necrotic tissues, and in cardiology they will be going for the regional myocardial blood flow and myocardial tissue viability. And in neuro and CNS imaging, they will be seeing about the types of dementia diagnosis, and it reveals the functional changes in the cerebral tissues, and in iris focal lesions in epileptic patients. So these are the conditions can be done in the application of PET CT. And some of the cases, that is, this case is showing the infection, suspicious infection in the renal side, that is confirmed with the biopsy, it shows a renal TB. So renal TB, after post injection of fusimide also, it has a high level of uptake in that image, the right side image you can see. So and then next thing is a mediastinal lymph node is being noticed in the lung area. It has a higher uptake, you can see the anatomical structure of PET CT image. And next case is abdomen shows the increased uptake in the peritoneal nodule. So you can see the peritoneal nodule after delayed imaging. uptake is very high in the peritoneal nodule. And that case is a melanoma showing metastatic lesion in the right thigh and foot. Below we can see the uptake will be increased. So this red color indicates the hot uptake region of a PET. So what is the advantage of this PET CT imaging is permits cost-effective whole body metastatic survey rather than doing biopsy, which has a incision and also a painful interventional procedure confirming the diagnosis. So we can do with this PET CT, go with this PET CT, and permits non-invasive differentiation of tumors from the radiation necrosis, and permits yearly changes in course of effective chemotherapy. To see the chemotherapy follow-up they will be doing, and also avoids unnecessary diagnostic and therapeutic surgeries. So this will be very helpful in the PET CT. And by concluding, this fluorinating FTG PET CT shows the images of glucose metabolism in brain and rapid change activity in the overall area of the body. And also, it is a fusion imaging modality which shows the mainly used in the clinical oncology imaging and also in the diagnosis of certain brain diseases. And it is a main thing compared to other imaging modality. It is a superior in sensitivity and resolution compared with other modality. So sensitivity is very important thing in diagnosing the diseases. And main aim to provide this PET CT instrumentation knowledge is to help the technologists to perform the day-to-day work efficiency and will produce high quality of images. Thank you.